Patty, we know that there's been a lot of research activity that shows that link between physical activity and the prevention of chronic disease,
Yes.
Or at least the amelioration of chronic
Yes.
disease as well. Can you tell us a little bit about that, and especially about some of the research you've been doing with cancer patients and survivors and the benefits of physical activity?
The research is so phenomenal, and it's wonderful for people to find out the news about this, because a lot of the chronic diseases we're dealing with now, such as type 2 diabetes, and arthritis, heart disease, and stroke, osteoporosis, they go on and on, right?
It's a lengthy
There's
list.
so many of them, and we call them lifestyle diseases because unfortunately, we acquire a lot of those because of the choices we've made in our life 20, 30, 40 years ago.
Right.
And that sort of is the bad news part, that we've acquired them not because of genetics, but because of how we chose to, you know, what we ended up eating for whatever reason, whether we were active or not active, the stress in our life, all those things that we do have some control over, hopefully. So that's the bad news. But the good news is, because they're lifestyle diseases, we can actually do something. We can do something about it ourselves. And we don't have to take a pill. We can look at how can I change my lifestyle so that I can either prevent getting some of these diseases, or if I do happen to have type 2 diabetes, I can better manage it so I can live healthier and longer with those diseases. So that is critical. And physical activity is huge in that prevention and or management of chronic diseases. And it's all those chronic diseases, even the cancer work, as you mentioned.
Right.
We did some great work with the University of Waterloo. They have a WellFit center there, and they have a specific program for cancer patients where they come in and they exercise, and it is an exercise program. It's not activity. It's a structured exercise program with qualified staff working with them. And from the research we gathered, and in speaking with the people there through their program, the benefits for cancer patients are quite significant, because when you're in treatment, generally speaking, you're tired, and so you do rest a lot more. You tend to lose strength. You tend to lose the ability to your capacity to function well all day because you are tired, and your quality of life really decreases. And the people who go into the program, when they start exercising, not only do they get the physical benefits of increasing their strength, they have more energy, they recover from their treatment faster, they feel better. The other huge piece is the mental side of it, because I haven't experienced cancer, but I know many people that have, and all of a sudden you have no control over your life. You've got this cancer, now you've got to deal with treatment, and you have no control over that. But when you're doing something for you and it's good for you and you feel good and you have control over that time, it really is beneficial. So the benefits are huge for those people who have cancer, who are currently in treatment. And the research has shown that people who are physically active can potentially reduce the risk of getting cancer again, which is huge.
Wow, that is
and
huge.
Also living longer. Cancer survivors can live longer. And so we also did some work to promote this information to cancer survivors. So an older adult who's gone through treatment and is now a survivor, even if they've never been active before, they can start to be active now, because they will reap those same benefits. They'll get more energy, they'll be stronger, they'll feel better, all the same things. They will reap the same benefits. So it really is significant. The physical activity component is phenomenal. And it's okay to exercise when you're in treatment, as long as you are aware of what you're doing and someone is watching you for certain strong exercises. But if you're just walking around the block, that's different.